Hello friends, welcome to this webcast from the IDS. It's Cristina Carrera and I'm going to talk about the patterns of Nevi. So we will find the overall patterns that you all know that melanocytic lesions can present. And of course, we can find the combination, for example, the globular and the homogeneous, or the reticular and globular, or homogeneous and reticular. Of course, the acral side will present the typical parallel furrow pattern, but I'm not going to going into this. First, number of nevi and the dermoscopic pattern will change according to the age. For example, in the early infancy, we will find homogeneous and globular patterns. According to the patient will become older. In the adolescence, most will be globular and reticular, and during youth and adulthood, we will find a large number of nevi, and most of them will be reticular. This is the same also with the combination, as you can see here, according to the decade. So the pattern will change according to the age, and also the number of nevi will increase when we get older. Another interesting point is that according to our skin type, our phenotype, the first skin type will present the biggest and the lightest nevi, in contrast to the darkest skin type, which presents the smallest and the darkest. Also, the size is related to the phenotype and the pattern, and the smallest lesions are normally the blue homogeneous blue nevi, and the biggest lesions are normally the complex and the combined patterns with reticular and globular, homogeneous and globular. The reticular pattern is by far the predominant during adulthood and more frequent at older ages. In contrast, the globular pattern is the predominant during infancy and adolescence, and also during youth. We know that these lesions can become larger, can grow, and we perfectly know this typical peripheral globular pattern, which is the most frequent found in growing lesions, such as in this case. These peripheral rim or globular patterns are most frequently found on the trunk, young patients during second and third decades, and we know that almost all of them will grow in a symmetric manner, and we know that they will stop growing after about 4 to 5 years. So the complex patterns, these typical growing and complex patterns, are expected to be found after the second decade of life. And we know that when compound nevi become more intradermal and more mature, we know that these globular patterns will change to this globular reticular or to the typical cobblestone pattern, which are these bigger and polygonal globules that are typical of the intradermal nevus. Also, they will lose the pigmentation, and sometimes we found globules, or sometimes we found just an homogeneous pigmentation, light brown pigmentation, or sometimes they lose completely the pigmentation, and we found just this papillomatous surface with the typical coma vessels, these short, linear, and curvilinear vessels on the top of the papillae. As you can see here, these typical coma vessels that are the clue to know that this is an intradermal verrucous nevus. And again, sometimes with these typical hairs without globules and with very banal homogeneous pigmentation, or completely pink lesions with these coma vessels. Few words about congenital nevi. They can combine the old patterns that I have mentioned. For example, in this case, reticular and homogeneous globular pattern with multicolor pigmentation, blue, black, light, and dark brown. Sometimes they can present this very typical patchy reticular pattern, most of them on the limbs with this hypopigmentation surrounding the follicular openings, and sometimes the opposite with these, again, terminal hairs, typical of congenital nevus, with this reticular and homogeneous blue, white, and black pigmentation, or in this case, with these terminal hairs and with this hyperpigmentation, which is the deep component of this congenital nevus. Of course, globular pattern on congenital nevus, mostly on the head and neck and sometimes on the trunk. And another additional feature typical of congenital nevus are these target and halo globules that can be very prominent. So the patterns of nevi, we know the combination reticular, globular, homogeneous. Of course, blue nevi are typical with this blue homogeneous pattern or blue and white. And for spitz nevi, you know the paradigmatic starburst pattern that will be covered in another webcast. So patterns of nevi, they can be really, really very variable, but the final clue, which is really helpful, is the comparative approach, which means that each patient will present their own pattern of nevi. So, for example, in this young guy, you can find most of his nevi are globular or homogeneous globular patterns, and all of them are very similar to the other. In contrast, in this lady with skin type 3, many of her nevi are reticular, hyperpigmented, and smaller, which is the typical in this phototype. So with this, of course, there are some specific features on special side nevi, but again, this will be reviewed in a new webcast, I hope very soon. So with this, thanks so much for your attention, and I hope you enjoy the webcast. Bye-bye.